transsexuality. One of the significant gaps in the existing research was research on people who'd had surgery under 18. And so we embarked on this study in our program to understand the impact of both chest dysphoria, but also surgery on trans masculine adolescents and young adults. And we wanted to assess complications as well. This was a cross-sectional study. We tried to capture every single young person that we had sent for surgery to try and get them to talk about what that experience was like. And we also recruited an equal cohort of people who had not been to surgery. There was far more young people who had not yet had surgery, but we just recruited to equal. The participants completed the survey in person or over the phone. We didn't provide an incentive, and everybody was available to participate. And we developed prior to that, based on the things that I had heard from thousands of conversations about what it meant to have a female chest contour when you did not identify as female. And so I put these elements into this chest dysphoria scale. We piloted it with some of the young people in our clinic for feedback. We did a factor analysis and ended up with 17 items that looked at across several domains. And each of them we scored on a Likert score from 0 to 3, never, sometimes, frequently, all the time. 0 is obviously the lowest amount of chest dysphoria, 51 is the highest. So here was what we found. We also really wanted to show if there were any differences in people who'd had surgery under the age of 18. So in our full sample of 136 folks, the average age was about 17.9. In the pre-surgical group, half that there were 68 of, the mean was about 17. We had 39 pre-surgical folks who were under 18 and 29 who were over or 18. And then in our post-surgical sample of 68, we had about half and half that had had surgery under the age of 18 and half who had had surgery at 18 or older. Here's the distribution of the ages at the time of chest surgery. So you can see we had, this is 13 years old, this is not a great pointer, but we had 2 young people who had had chest surgery at 13, 5, at 14, 9, at 15, 9, at 16, and 8 at 17, and the rest 18 and older. So what type, well, some people weren't sure what type of surgery they had, but that was only one person. Most of the folks in this sample had had double incision surgery that you just heard about from Dr. Mosser. But we also wanted to look at this recommendation about being on testosterone, because when the insurance companies come back to me with, this is not medically necessary because your patient hasn't been on testosterone long enough, and since that's what our guidelines recommend, it's a tough thing to talk about. So we asked people how long they've been on testosterone prior to surgery. And in our under 18-year-olds, most of them had been on testosterone less than a year. And about 44% had been on a year or more. In our olders, 18 and older, about a third had been on testosterone less than a year, and 2/3 had been on for 1 or more years. And I'll tell you why this is important in a minute. So then we asked, we wanted to assess the length of time between when the person had surgery and when they were taking the survey to just show that there was not a lot of, we wanted to assess, was there differences in patient satisfaction if they'd been longer out from surgery or if they'd had surgery 2 weeks prior to when they were doing this. And we had a pretty good spread. We had 9 folks who were more than 3 years out of chest surgery. We asked about complications. The most common complications had to do with loss of nipple sensation, either temporary and it had come back, or long-term for folks who had been out longer and it had not come back. Loss of sensation in other areas of the chest, so sometimes people have numbness in and around the surgical incisions, but there were a smattering of other things. So there were sort of anesthesia complications. I felt like there were some cosmetic issues around my nipple or areola being too large. Dog ears, do folks know what those are? So if people have bilateral incision and they have a little extra weight, sometimes there can be like dog ears or little corners of tissue that are underneath the axilla or in the armpits. Unequal chest appearance, excessive scarring, so these were, but overall, the complication rate was pretty low except for nipple sensation. What about time on testosterone and chest dysphoria? So this is, I've always wondered about this. You have to be on testosterone for a certain amount of time before chest surgery because clinically that doesn't match up. What happens for people is they have a lot of dysphoria, they go on testosterone, their body starts masculinizing and their chest dysphoria skyrockets because now there's a bigger discrepancy between the way you look and your chest. So we looked at this and we found, not surprisingly, that the length of time on testosterone was a predictor of increasing chest dysphoria scores. So in the pre-surgical group, chest dysphoria scores would increase by 1/3 of a point each month that they were on testosterone and had not had surgery, equaling an increase of 4 points over 1 year. Now, the chest dysphoria scale is not, it's not like, oh, anyone who has a chest dysphoria scale of 20 or over should have surgery. That's not what it was created for. I created it so that we could understand some more of the nuances of what it means to have a chest contour that is not appropriate for you. And this is important because a lot of times in this work we talk about, oh, I just hate my chest, right? We don't explore or talk to or understand some of the more nuanced issues or experiences that people have around this. And this is really, really important when we're talking about decision making. And you're going to hear me say this wherever you hear me talk. But the major difficulty to overcome in this work is because the care is organized around all the cisgender people around the trans person feeling comfortable. It's not really rooted in helping people improve their lives. It's organized around all of us feeling okay about all of you experiencing or going through medical interventions. And that's really critical because that is where we 100% get it wrong. We ask this question, do you regret having surgery? Was it a good decision to undergo male chest reconstruction? 100% yes. 100% across the board. Do you ever regret having surgery? 100% never. In the kids who had surgery under 18. One person said they sometimes regretted their surgery, and here's why. That person very much was planning to carry a child, and they had a lot of concern around not being able to chest feed that child. And we went over this and over this at every visit. Like, let's weigh what we're looking at. We're comparing or talking about your distress around your chest compared to what you want to do for your future child, right? And it got unbearable. This young person had chest surgery eventually because it was not bearable for him to actually continue to not get surgery. And I'm happy to report he had a child this last year and things are going swimmingly and it's been fine. Sorry. Okay, so I just want to talk about sort of what we learned from this study. This was published in JAMA Peds this year, so if folks want to see it, it's available. Trans masculine individuals who've had male chest reconstruction have lower levels of chest dysphoria. And chest dysphoria after surgery is low in both folks who got surgery under 18 and those who got it 18 or older. Patients reported relatively low complication rates and little or no regret. More time on testosterone prior to chest surgery was associated with increasing levels of chest dysphoria, and male chest reconstruction or chest reconstruction should be considered for patients on an individual basis, not adherence to an arbitrary chronologic age or length of time on testosterone. This is also problematic. I want to tell you another weird thing about the WPATH guidelines. In the adult section, they say hormone therapy is not a requirement for chest surgery. But in the adolescent section, they make hormone therapy a requirement for chest surgery. It really doesn't, I don't understand. I wasn't invited to that party, so I don't really understand why that was put forward as something. Should you think that I'm horribly biased in my checking for information, I also searched these things on Tumblr. Trans man top surgery regret? Nothing. Trans masculine top surgery regret? Nothing. This is about it for trans masculine top surgery regret. Try another search? No. So I'm going to wrap up my portion by saying thank you to my amazing partner, Johanna Olson-Kennedy, who's in the back, and he's speaking later today. I have an amazing team. My team, I didn't have a team for a long time, and I was like this weird, like, one-person band. It was like that monkey with the drum and the, but I really do have a great team, and I'm so grateful for them. But really, everything that I've learned in my experience doing gender care has come from my patients. And I'm really, really grateful, because this is, I was really not happy with medicine when I first started doing it, and when I found this work, it really changed my life. And so we want to open it up for questions and comments that people have. It's very, very rare that I leave time for questions, so this is really extraordinary. And I'm going to go back and put Dr. Mosser back up here. We'll find his face down here. There you are. Go.
So I'm a psychologist who works with trans youth, and when I endorse them for surgery for through the insurance companies, there's a part of the form that says I have discussed the complications or the problems with these procedures, and just ethically, what am I supposed to say to them?
Well, I mean, this is what, you remember what I said about this all being about the comfort of the cisgender folks around the trans person? This is a great example, right? Where in other mental health domains are you all asked to talk about the medical complications of a procedure, right? So here's one thing that, I'm not a mental health provider, but I can imagine that there are very, very specific things that people need, the insurance companies need to feel okay about somebody else's body. You can say, I've talked about the complications, because now you know some of them, and you can also say, and there's very, very little regret. And they know that, they understand. The challenge is that with minors, they need parental consent in order to undergo surgery. And so what are some things that I do with parents? The truth is that sometimes it's time. Sometimes I know that it's time and it's painful, and I have to make sure that I'm having a conversation with the young person about, like, I see you and I hear you, and this might take some time, and I'm fully committed to getting your parents there. And it really is, if you have those conversations for people. And by the way, I keep a poster version of my chest dysphoria study, a mini version of it that I give to parents. And I say, read through this and look at the profound impact of chest surgery, because of all of the things that we do for trans folks, name and pronoun and chest surgery and genital surgery for trans feminine folks are the three, and maybe facial feminization, the most impactful procedures, without a doubt. I think probably maybe even more than testosterone. I think that chest surgery is a profoundly important procedure for people. And I think it's very important when engaging parents to help understand what their fears are. What is your fear? Let's talk about and address the things that you are concerned about for your young person, right? And we all know, if you do this work, you know it's the same 5 things, right? What if they regret it? What if they change their mind? What about cancer-causing hormones? What about testosterone and estrogen being bad for your body? And what about my grandchildren, right? And that's really, everything sort of falls under those domains, right? And so really helping move through and say, okay, let's talk about the places that you're stuck here, right? And let's talk about, I mean, I've even moved to talking about, like, let's really look at what we're weighing, right? Because we're balancing, if we're rooted in this idea, these falsehoods of, A, we can make someone accidentally trans. And that sounds really stupid, but people actually think that, right? Like, well, you're going to make someone trans who isn't. Even though we've been working really hard to make trans people not trans and failing horribly at it, right? But we have some kind of relationship with cisgender fragility. That's not a thing, but people have a relationship with it. If you're rooted in, and the worst possible outcome is that you're trans. right? These are the sort of undergirding things that make all of this really hard for people, right? Because they're still rooted in gender essentialism, we're gonna accidentally make someone trans who isn't, and being trans is the worst possible outcome, right? But none of those things are true. And so helping get to the root of the cause, and I'm very judgy. I really appreciate you said that, because I'm a very judgy person. I really try to rein that in when I'm with parents, because I know that that's really important, right? Like, this is their one trans kid. I've had 1,000 trans kids and 1,000 families and 1,000 conversations that are the first conversation. But for them, it's their first one, right? And so really trying to say, okay, well, you know, and listening is a big part of that. Because I think a lot of times parents of teenagers don't feel listened to. And that's a real big problem.
Well, if it's
I'm just going to say this, that actually people get married when they're under 20. Actually, people choose colleges to go to. Actually, people make life-altering decisions in adolescence. All the time. All the time. And honestly, most of them are good. It's just the bad ones that we talk about. Oh my God, the cinnamon challenge, right? I mean, why do we know about it? Because it's a thing, and it's not common. Like, most teenagers aren't eating cinnamon, right? But some are, and they're on YouTube, and that's stupid. But we don't put on YouTube the things that are really good decisions, right? Oh my gosh, my kid took the SATs. Not a very exciting after-school special, right? But so what we do know is that adolescents actually have the capacity to make a reasoned, logical decision. And here's the other thing about chest surgery. If you want breasts at a later point in your life, you can go and get them. And there is actually a really great paper on the side effects of binding that came out a couple years ago, and that might be another great place, and making sure that people aren't going to use that as a reason to deny binders to their young people, but as a, like, okay, you know, oh, and another great thing, if you have parents who have chest tissue themselves, they can wear a binder for a day and get a lot of opportunity for empathy.
Or citizens say thank you for talking about postoperative depression. It's so important. Nobody talks about this. It was really hard for me. Or occasionally adult patients tell me that they're really struggling with depression after surgery for a little while. Interestingly, it doesn't seem to happen at all in my adolescent patients. And I'm developing a little bit of a theory that, you know, postoperative depression is really just life after surgery is really hard for a short while. And if you don't have a support system, you're going to feel really lonely and really fragile, and that might help you feel depressed. I'm sort of learning that. I think a lot of the adolescents that are making it to surgery have a tremendous support system in place that is doting on them after surgery, and that's enough to not have any postoperative depression at all. But if you're alone and an adult and struggling to pay the rent and you're feeling super fragile, you don't know if you're going to descend towards oblivion. And so anyway, that
I lost you.
went on, and now I'm saying that it's probably not. Sorry, I must have disappeared.
No, you're cutting in and out, but that may be another thing for having surgery younger, actually, is the support system in place.